relative to the data, and then I have a couple things that I'd like to share before Glenn Kemp will speak to you, and then Chaplain David Curtis will have our pastoral care segment today. In terms of the COVID-19 data, there's been 361,519 tests performed. We're really seeing some of the testing ramp up, and we're seeing more than 10,000 tests a day, and that's a good thing. Cases, positive cases, we're at 48,532 positive cases. It's an increase of 676. So while there's more testing happening, there's actually fewer cases new cases being reported each day, and that's also a very good thing. And then the positivity rate for the Commonwealth of Virginia, the whole state, it's at 10.1%. That's down a half a percentage point, 0.5. That's really good news. Henrico is at 11.6. That's up a half a point, but we're seeing that kind of go up and down. The trend is down, but day to day it's doing a little bit of this. Richmond is at 14.0. That's down 0.1%. Hospitalizations, we're at 5,008 total, with 1,452 people currently hospitalized. 320 of those are in the ICU, and 161 of those in ICU are needing ventilator support. We've had 1,453 deaths. That's an increase of 8. Again, we're seeing the number of deaths per day go down. That's a really good sign. And we've had 6,392 people considered recovered. All in all, the data is beginning to look better. Certainly not down to where we feel good, but much better than it was, and so that's good news. Here on campus, a couple updates. As you know, the residents of Avalon, Monticello, and Gables assisted living areas are currently in quarantine from the potential of exposure from our assisted living staff member who tested positive a week and a half or so ago. I want to stop for a moment and speak to the residents of assisted living and just thank you for your patience and your grace. As you've been dealing with the challenge of being in quarantine, which we know is very hard, and also the fear that comes with needing to be tested and not knowing what the situation is. We fully expect that all the residents in assisted living will test negative. We feel confident. Our staff member was very diligent about making sure that she wore her PPE and took good caution for our residents, but we need to be extra cautious, and we just need to ensure that we do not have an outbreak. And so that's why the quarantine, and that's why the testing. We have tested all of the residents and staff of the Avalon areas, and we're awaiting those results. We should be getting some back today and some back tomorrow. And assuming if we get all the results back negative, and we're assuming we will, that all the Avalon residents will come back negative and all the staff come back negative, then we will retest the Avalon residents again next Tuesday, June 8th. If all of those results are negative, which we'll probably get back Thursday or Friday of next week, we'll lift quarantine for those residents in Avalon as soon as we get those negative results back. We are testing the residents and staff of Monticello and Gables today, and we, again, will assume that everyone we test today will be negative, and so that the residents of Monticello and Gables will be retested for a second test on June 13th. And then once we get those results, come off of quarantine. Now again, that all assumes we get a bunch of negative results, and we expect and certainly pray that we will. We're also in the process of testing more staff in the Parsons Health Center today, and the testing will continue into the next week. These tests are being administered by our staff and being sent out to the lab by us. The reason we're doing it is that we get the results back directly to us, and we find that it's quicker. We can get to the results immediately rather than waiting on them to come through someone else. So that's a lot of information. I hope that's helpful. Over the past couple of days, I've had a few questions come to me that I'm confident many of you are asking, so I thought I'd address a couple. The most relevant questions that I've been getting are the first: what happens starting Monday as residents leave campus for essential business? What happens if someone tests positive in independent living? And then who decides what the course of action for Westminster Canterbury is going to be relative to quarantine and testing and all that? The answer is it depends. And I realize saying that's not an answer. So let me explain what I mean by it depends. I'm going to use an example to explain. So the first example is a resident goes off campus to do whatever personal business they need to do or go to a medical appointment, and they get exposed to the virus, and they come back into Westminster Canterbury Richmond. But that person was good about wearing his or her mask, sanitizing his or her hands frequently, and really had no close contact after coming back on campus with other residents. Once we find that person is positive or symptomatic, we're going to do our contact tracing and figure out who were they near, who were they around, who was around them not wearing personal protective equipment. And that effort will tell us, because the person wore a mask and was good and kept his or her distance, that only that individual who's sick, or maybe one or two others who were up close and potentially got exposed, would need to be quarantined and tested. And that's something we would manage, right? Because it's very localized and the risks are low, and we can explain to VDH what the process was. That's the best case scenario. And essentially all the rest of the community is unaffected by that new case and the contact tracing, just those that were up close and perhaps were around that resident unmasked or really for a long period of time. The other example is a resident goes off campus to do whatever he or she wants to do, needs to do, and gets exposed to the virus, comes back into Westminster Canterbury, gets together socially with other residents, and they as a group or as a group of individuals don't protect themselves adequately, either in public or in a private of the home. They would expose each other, and that could cause viral spread to others on campus, because now we've got multiple people who have the virus and are moving about the campus. Then we have an outbreak. That will likely require us to quarantine many or all of you again until such time as the National Guard and the Virginia Department of Health test everyone. That's sort of the worst case scenario, but that has a whole bunch of different possible paths. The question of who decides how the event is handled will depend on which scenario happens. If it's localized to an individual or a small group that we can trace and test, quarantine ourselves, then we're going to maintain control. And that's frankly what we want to have happen if we're going to have any more infection in independent living. If there's viral spread that we can't trace easily, then, and it leads to an outbreak, then Westminster Canterbury Richmond, John and the team, we lose some control while the National Guard works with VDH. And we'll report to VDH, and VDH will report to the National Guard for a period of time while we get everyone tested and get a plan for how we're going to control it. Those two scenarios, I mean, we and you have the responsibility to choose which way this goes. So it's the main reason we really need you to take responsibility for your safety and the safety of your friends and neighbors and the staff. Is we want to keep control of this. If we keep control of it, we can continue to move forward towards a positive reopening. If we lose control for a period of time, it's going to be difficult to get back on track. So hopefully that was you understood that. The second question I have been getting, and a number of us have been getting, is what are we going to do about the residents that are not wearing their masks in public, not wearing them correctly in public? A number of residents have said seeing that makes them uncomfortable, or it scares them, or it makes them, it scares them or it makes them uncomfortable. And that's completely understandable. Needing to be around others who aren't masked is scary. In the public, outside of Westminster Canterbury, I would say, from my experience and from the experience of my family and the others that work here, approximately half of the people you're going to see outside the gates are wearing masks. It depends where you are, but in a grocery store or in a gas station, those sorts of things, about half. And I'll be honest, it makes me very uncomfortable. But in public, just like here at Westminster Canterbury, I wear a mask wherever I go to protect myself and to protect you and to protect the staff. And the staff do the same thing. Our job is to keep the infection away from us so we can keep it away from you. We need to take responsibility for ourselves, and you're going to have to take responsibility for yourselves. If there's someone in a space here on campus that you're needing to go into and they don't have a mask on, you need to wait. You need to stay, and you need to wear a mask, and you need to wash your own hands. Take care of yourself. The person not wearing the mask is the one at risk, not you if you're wearing a mask and washing your hands. So that's the main point. Take responsibility for yourself. We're management, staff, we're going to do what we can to correct residents that we see in public without a mask. And we're not going to allow residents that are unmasked or not wearing them correctly into program and service space without complying with the requirements. So you need to get used to it because there's a lot of people not wearing them, and you need to be comfortable wearing one to protect yourself. And if you're wearing one, you should be safe. And if you're washing your hands frequently or sanitizing your hands, you'll stay safe. Couple more things. A couple pieces of advice for those of you planning to leave campus at some point next week. In many ways, outside the gates, it's a new day as you go out there in terms of going to the store or going to the doctor's office. I've said this 3 times already, and I'll probably say it 5 more times by the end of next week. You need to take responsibility. You need to wear your mask. You need to keep your distance, wash your hands, and stay home if you're not well. That goes for inside the fence. It goes for out in the community. When you go off campus, do yourself a favor, keep some sanitizer in your purse or in your pocket, keep some in your car. Use it every time you get in and out of your car. As soon as you're done pumping gas, using your credit card, signing a receipt, or before touching anything else, use your hand sanitizer. Just get used to using it after everything you touch, because anything you're touching could have the virus on it. When you're in a grocery store, this is probably the most confusing thing we're all dealing with, right? We go into a grocery store. Grocery stores have capacity limits, so you may not be able to go in. You may have to wait in line to get into a grocery store if you go at a busy time. That's something we've never dealt with, right? When you get into the grocery store, someone will need to have wiped down and sanitized your cart for you, or you will need to sanitize it. If you go to Publix or Kroger, they're going to do it for you and give you a cart. But if you go anywhere else, you're going to need to sanitize your cart. As you come into the store, there's going to be markings on the floor as to which way to go, because most grocery stores are a one-way thing now. You go down an aisle one direction, and there's like do not enter signs at some, can't go against traffic. That's a whole new experience. First time I went, I've only been a couple times in the 3 months, but one time I went, I ended up walking down the aisle the wrong way, and I got scolded by a teenager for going the wrong way. So just be aware that the rules in grocery stores have changed. Don't wear gloves. Don't wear vinyl gloves when you go into a grocery store. You'll see people doing it, but those gloves are sticky, and they're going to pick up Everything, all the virus, all the germs that are on everything, you're going to touch them, and it's going to stick to you. Unless you're planning on taking those gloves off after everything you touch, don't wear gloves. Use sanitizer. And don't touch anything you don't plan on putting in your cart, right? If you're going to take it, put it in your cart, but don't touch things and put them back. Just touch what you're going to take. Keep your distance from other shoppers. For those of you that haven't been out there, that's going to be weird, right? There'll be someone standing at the milk area looking at all the options. You've got to stand and wait for them to make their choice before you can go up. If you push your way up, I don't mean that literally, but if you encroach in their space to grab the milk right next to them, one, you're breaking social distancing, and two, you might get growled at because they might not like it. So you have to be patient. You have to let people vacate the space before you move into it. That's what social distancing is all about. And it's new. It's something we've never had to deal with before. You got to maintain your distance at the cashier. When you get in line, there'll be markings on the floor, and you need to keep your distance. There'll also probably be plexiglass between you and the cashier, and then they'll probably wipe down the credit card machine after every transaction. So just watch for those things. Completely different. Be patient with it and learn, because it's a new thing. You got to pay attention and learn how the process goes. So next week, we're going to spend a little time talking about these things throughout the week. A couple other real quick things. Things you might want to know when you leave campus. Westbrook looks great, drives great. The asphalt looks fabulous. But when you get to Brook Road looks very different. There's a bike lane and a parking lane, and it's essentially a one-lane road each direction, north and south, and there's a lane, and then there's a parking lane, and then there's a bike lane. You might have seen that downtown before COVID-19, but it's very different. So don't be surprised if in the right lane there's cars parked. So there's two lanes. The right lane is actually a parking lane. It's very different. Just be very, very careful. I wouldn't want anybody to get hurt right out of the gate going down Brook Road. The other thing, just especially in the residential neighborhoods, people are going as stir crazy out in the community as you are, so you're going to see a lot more Presbyterians. Pedestrians, sorry, I apologize. A lot more pedestrians out and about. It's a good thing. People are out walking. Lots of people are out walking and riding their bikes. So just be careful. It would be a tragedy to get out finally and then have an accident. So be careful. A couple other things. Remember that our offices in administration, the foundation, the clinic are not open to walk-in visitors. We are starting to see some folks come and try to come into an office or come to the clinic without an appointment. Please call ahead so that we can be ready for you and have the space cleared. When you have an appointment for the clinic, please wait in your apartment until they call you. Then you can come down for your appointment. They have to clean everything between every appointment, and we can't have people waiting in the lobby at this point. So wait in your apartment, we'll call you, and they'll come down, or then you can come down. Lastly, Fun Friday handouts are available at the front desks this afternoon if you want to come down to one of the desks and pick them up and enjoy that. Next up is Glenn. Have a great weekend. I'll see you on Monday.
Thank you, John. Yesterday, we went over the gate process for independent living residents who will be able to leave campus starting on Monday, June 8th for essential tasks. I simply want to remind you about how this process will work. So, we will not be tracking residents as they leave campus, but we will be keeping a log of your return. You are required to be screened at the gate upon your return. Please enter campus at the lane closest to the gatehouse. There will be signage directing you to the correct lane. When you return, a screener, which could be an officer or another Westminster Canterbury staff member, will use an oral thermometer to get your temperature reading. These staff members have been trained on the proper procedures for this, avoiding cross-contamination between temperature checks. You'll be asked a question about symptoms related to COVID-19. If you register a high temperature or answer yes to any of the symptoms, you will be instructed to go directly to your apartment, and a nurse from the clinic will follow up with you. Please wait at your home until the nurse arrives. We will be screening all residents who leave and return to campus. This includes residents traveling for essential tasks, whether using your own transportation or Westminster Canterbury's transportation. Residents who leave campus for cycling or walking will also be screened when you come back through the gate. Just a note for Glebe residents, we ask that if Glebe residents leave campus, please come to the gatehouse to be screened prior to returning to your home. Lastly, if residents travel off campus overnight for personal or medical reasons, they will undergo quarantine and be tested for COVID-19 after 5 days. Once they receive a negative test result, their quarantine will end. If residents do not want to be tested for COVID-19, they will enter a 14-day quarantine when returning to campus. Please notify Resident Services at extension 6082 if you plan to be away overnight. Now I will present to you David Curtis. David.
Good afternoon, everyone. I'm David Curtis, one of the chaplains here at Westminster Canterbury, and a short programming note from Pastoral Care. This coming Sunday is Trinity Sunday, and Philip Martin, who is the pastor of Epiphany Lutheran Church in Richmond, Virginia, will preach for our sermon for every Sunday that will be shown on TV 970 at 4 p.m. This coming Sunday, on Trinity Sunday, Martin will focus on the creation story from Genesis and from Psalm number 8. Philip will say that creation was thoughtful and very carefully laid out, and he argues that it's also an ongoing process. So join Pastor Martin as he explores the bigger truths of the why and the who of creation and how it impacts our identity as God's creation today. And now hear these words from Scripture, from the prophet Isaiah, chapter 61, verses 1 through 4. The Spirit of the Lord God is upon me, because the Lord has anointed me. He has sent me to bring good news to the oppressed, to bind up the brokenhearted, to proclaim liberty to the captives and release to the prisoners, to proclaim the year of the Lord's favor and the day of vengeance of our God, to comfort all who mourn, to provide for those who mourn in Zion, to give them a garland instead of ashes, the oil of gladness instead of mourning, the mantle of praise instead of a faint spirit. They will be called oaks of righteousness, the planting of the Lord to display his glory. They shall build up the ancient ruins. They shall raise up the former devastations. They shall repair the ruined cities, the devastations of many generations. The word of the Lord. Thanks be to God. And today I offer you a prayer that is actually in the form of a poem written by Maya Angelou. It is entitled The Caged Bird. A free bird leaps on the back of the wind and floats downstream till the current ends, and dips his wing in the orange sun rays, and dares to claim the sky. But a bird that stalks down his narrow cage can seldom see through his bars of rage. His wings are clipped, and his feet are tied. so he opens his throat to sing. The caged bird sings with a fearful trill of things unknown but longed for still, and his tune is heard on the distant hill, for the caged bird sings of freedom. The free bird thinks of another breeze, and the trade wind soft through the sighing trees, and the fat worms waiting on a dawn-bright lawn, and he names the sky his own. But a caged bird stands on the grave of dreams. His shadow shouts on a nightmare scream. His wings are clipped and his feet are tied, so he opens his throat to sing. The caged bird sings with a fearful trill of things unknown but longed for still, and his tune is heard on the distant hill, for the caged bird sings of freedom. And may we all sing in whatever words and whatever songs we can for freedom, freedom from injustice and bigotry and violence. Today, at sundown, we will welcome the Sabbath. And at Sabbath, may we all rest in God's peace, in God's shalom. Shabbat shalom to you. Thank you for joining us today, and please join us for our next update on Monday at 3 o'clock.